Attention, everyone. We have 2 minutes, 2 minutes until we begin. Everybody, we have 1 minute, 1 minute until we begin.
Recording in progress.
Good afternoon. Thank you for joining me for this virtual media briefing about our continued response to COVID-19 in Jacksonville. I want to start by thanking our local media partners for joining us and for your help in delivering our message, encouraging more citizens to get vaccinated. Last week, after our last news conference with area healthcare leaders on July 21st,
Recording in
pandemic
progress.
behind us once and for all. So the primary focus for myself and my team, and for those leaders here with me today, is to encourage everyone in our community to get vaccinated, to get more shots and more arms. When we put the mask mandate in place last year, we did not have access to the vaccine. Now we do, and it is the most effective way to protect our community. This isn't about bullying people about vaccinations. This isn't about shaming individuals. Some people have legitimate concerns and questions, and that's okay. But I encourage those folks to discuss those concerns with a trusted, reputable medical professional. And I think in most cases, they'll find the vaccine is a safe and effective answer. So please get vaccinated. It works, it's effective, and it could save your life. To talk more about this, I want to turn this now over to Dr. Soleimani from Avencina Medical, Since the start of the pandemic, Dr. Soleimani and his staff have treated thousands of patients with COVID-19 and administered more than 200,000 rapid tests for the virus. He's with us today to talk more about the vaccine and measures we can take as a community to stop the spread. Doctor?
Thank you, Mayor. I'm Dr. Soleimani with Avicenna Medical. We have been involved with treating and testing COVID-19 since the beginning of pandemic last year, and have treated thousands of patients across Jacksonville. And so I have a pretty good idea of what's going on this year versus last year. What we can tell you is that the Delta variant is significantly more virulent than the original COVID-19 that we saw last year. Data showed, and what we saw across Jacksonville, almost 40% of the patients that we saw last year that were positive were asymptomatic. So that was a very common theme throughout last year's outbreak. We had many patients that would come in that would test positive that either were asymptomatic or were minimally symptomatic. This year, that story is not the same, where the ratio of patients that are asymptomatic are almost non-existent. So patients that test positive are quite sick and quite symptomatic. We also see that the ratio of younger, healthier patients that are being affected by this Delta variant is significantly higher than it was before. Jacksonville's positivity rate last year was in line with the nation. You know, we consistently were around a 10% positive rate. So if we tested 500 patients, roughly 50 of those patients were positive. This year, we are north of 20% on a day-to-day basis, and there are some days that we tend to be in the upper 20 percentile. The Delta variant is much more virulent in a sense that viruses are tracked epidemiologically by something called an R0 value. And the original COVID-19 had an R0 value of 3. And what that simply means is that one infected individual can infect 3 other people. The Delta variant has an R0 value of 8. And what that means is that that one infected individual can infect 8 other people. So what that means is that it can spread through a population at a much faster rate. So the higher the R0 value of a virus is, the worse it can be out. You know, the outcome can be worse, and it spreads at a much faster rate. Vaccination has obviously been very controversial since it has started. But one thing I can tell you is it is hard to deny the facts and the data. And the data shows in our hospitalized patients across Jacksonville and really across the United States, more than 95% of patients that are hospitalized are unvaccinated. Now, does this mean that if you're double vaccinated that you cannot catch COVID-19 or the Delta variant? Absolutely not. Every day, we still see patients that have been double vaccinated and they still catch COVID-19. But the key difference is that these patients don't end up in a hospital or on a ventilator. So our patients ask us all the time, hey, is this vaccine safe? And you know, the question and the way I like to reply to our patients is, what do you consider safe? And then I'll let you know if this vaccine is safe. The vaccine, like many things in life, have potential side effects, but the data overwhelmingly shows that the risk-benefit ratio far outweighs being vaccinated. I was having conversation with some of our leaders this week, and I mentioned almost 5,800 people die every single year from choking on their food. And that's the most basic necessity of life. And still almost 6,000 people die from choking on their own food. And so do we consider eating not safe? You know, 38,000 people die annually from motor vehicle accidents. But knowing that risk where one person dies every 7 minutes, we still get in our car, strap our kids in, and go to work or do about our business. Except we take that risk and know that what we need to get done far outweighs that potential risk. So even though there have been some reported side effects from the vaccine, the fact that we can look at our hospital ICUs and see that 95% of patients that are hospitalized are unvaccinated clearly shows that for patients that are particularly elderly, higher risk, immunocompromised. Being vaccinated significantly helps reducing the chances of morbidity and mortality.
Thank you, Doctor. And now I'll introduce my colleagues at our beaches communities to say a few words, starting with Atlantic Beach Mayor Ellen Glasser. Mayor Glasser.
Yes, thanks, Mayor Curry, for this opportunity to share our united message on getting the vaccine. And thanks for allowing us to repeat and amplify this message to our residents on how they can protect themselves and others. In Atlantic Beach, we have focused on education. That's through our website and other platforms to provide information about getting testing, which is super important, about where to get vaccines, and yes, about facial coverings in the public domain. We want people to get tested early, and we want them to stay home if they're feeling sick. We're also talking to our businesses and to other service providers. Our employees have been strongly encouraged to get vaccines and to wear masks when dealing with the public. I feel it is our duty not to put anyone at additional risk for this contagious variant. And if people have a problem with the vaccine, to put them at ease, to put the public at ease with our posture. So I'm just going to say that I do implore first responders who have hesitated to get the vaccine to get it, whether their employer has mandated them to do it or not. I know from personal experience just in the last week that people who need our help or who are vulnerable should not have to worry that a responder is not fully protected and may unknowingly pass the virus on to someone else. So this has been a long haul. It's not over. I find that when it becomes personal to people, they may change their viewpoints. And for some of us, it's been very personal and very profound. So for me, it's been the loss or the serious illness of more than a dozen people in my personal sphere. And it's been the source of great worry to those that I love who aren't vaccinated. So I think it's important that we share these concerns publicly, and that our message is the virus is the enemy. So maybe a message of love and concern is what will make the difference for someone that you love to get the vaccine. With that, I'll answer questions later, but I will turn it over. Mayor Curry, if it's all right, I'll just go ahead and throw it over to Mayor Elaine Brown from Neptune Beach. Thank you so much.
Mayor Brown.
Good afternoon, and Mayor Curry, thanks again for holding this. To my colleagues, I hate joining you for this, and Mayor Curry, we've been through this before during the pandemic. I have to say that right now, it's the unvaccinated is the reason that we're here. And to get the message, we're all saying the same thing to you right now, but I really want to say that the trickle down is so important. You know, hospital beds, having people go to the hospital and having to wait, seeing people who are younger, even children that are now seriously ill and some dying. You can protect yourself. You can get this vaccine. And right now, you need to be part of the solution, not part of the problem. I want to share a story with you that is just amazing to me. But a company that supplies oxygen to people in their homes. I heard the story that they were in the past serving about 12, 15 people a week. They're now getting requests at 25 people a day. They are not able to serve all of them. Oxygen is limited. The trickle down of all of this is something that we don't even think about, but it's there. You need to wear your masks when you're out in public to protect yourself and others. But the most important thing that we can say today, and I'm joining Dr. Soleimani, Mayor Curry, Mayor Hoffman, certainly Mayor Glasser, to say in unison, and please get the vaccine, stop this pandemic. It's the only way we can do it. Get the scientific facts, talk to your providers, get the facts, get the vaccine. And Mayor Curry, That is a phenomenal amount of people, 15,000 that actually got it after your last. I'm hoping 100,000 will go out. Everyone needs to get vaccinated, and it's free. This could save your life and the lives of your loved ones. Thank you so much.
Thank you, Mayor. And now Mayor Chris Hoffman, Jacksonville Beach.
Thank you. Thank you, Mayor Curry, for providing this opportunity for us to speak to the community. I want to echo the sentiments of my colleagues and add that we all have our personal freedoms and the ability to make choices for ourselves, and I respect that. But on April 19th, when I walked into Old Regency Mall for the Pfizer vaccine, I made a choice. I chose my health. I chose the health of my family, my coworkers, my community, and I'm so glad that I did. I chose to make sure that I was not going to be the cause of a hospital bed, ventilator, or oxygen tank being taken away from someone who did not have that choice, and I encourage you to do the same. We have the tools now to end COVID-19's impacts on our community. Please use them.
Thank you, mayors. This is something that affects all of us as an entire community, including our beaches cities, and we're all in this together. And this pandemic also has effects in other areas of our government as well. To talk more about this, allow me to introduce our public defender, Charlie Kofer. Judge.
Thank you, Mayor Curry. When this pandemic struck in March of last year, our courts basically shut down for a short period. With the cooperation of our chief judge, the state attorney's office, and the sheriff's office, and my office, we were able to make quick adjustments to handling our courts virtually. But despite our efforts, we have experienced a huge backlog in the number of cases pending. At this moment, we now have 51% more felony cases pending than before the start of the pandemic. All of us knew that our hopes for getting back to normal was the development of a safe and effective vaccine. And when those vaccines were approved at the beginning of this year, we were happy to see how many members of the community made the decision to be vaccinated. The spread of the virus slowed enough during the spring, we were able to restore much of our regular court functions. Unfortunately, just as our community was starting to get on top of this virus, we let our guard down. Vaccination rates dropped, just as some of the more contagious variants were taking hold. And now our courts are faced again with having to cope with a rise of COVID in the community. Our justice system deals with rights and responsibilities. It is what we do for a living. And we all understand that the decision to vaccinate is a personal one. All adults have the right to decide whether to be vaccinated or not. But I'm here to talk about responsibilities. When I was a child in the late 1950s, polio was paralyzing large numbers of children and young adults. When a vaccine was developed, vaccination centers were set up in our elementary schools. And I tell you one thing, everyone in our community understood the responsibility to get vaccinated. Every parent brought every child and family member down to school, and we stood in long lines to be vaccinated. They did it because they understood the responsibility that they had toward their families and their community. Our community has the ability to defeat this new virus if everyone who is eligible steps up to be vaccinated. So Jacksonville, join the effort to protect yourself, your families, your community. Talk with your doctors, talk with medical professionals, and please, please get vaccinated.
Thank you, Judge. A final reminder, if you want to get the vaccine, go to vaccines.gov and find the location nearest you. With that, we will open up for questions. I want to remind reporters to use the raise hand function here in Zoom. We will call upon you and unmute your microphone when it's your turn. We'll start with Patricia from the New York Times.
Hi, Mayor. Thank you. I had a question for you about are we basically having to learn to live with this virus in the long term? Do you sort of envision this being a every year cycle? Is that what your panelists are planning for? I'm just trying to get a sense of how we balance having life and work and school and along with trying to avoid having overwhelmed hospitals and having these sort of crisis points. So how are you looking at that over the long term?
Yeah, medical professionals have said and suggested that we are likely going to have to learn to live with this, but that the answer is getting vaccinated. And that's really why we're here today. We saw a pretty big uptick in vaccinations. So we did one of these a week and a half ago, and we're hoping that today that we'll get people vaccinated. And with that, there's much lower risk. Hospitals don't fill up. Kids can go to school and feel safe. People can carry on with their activities, recreational and work. Thank you for your question. Scott Johnson, News4JAX.
Mr. Mayor, can you hear me?
I can.
Two questions. The first one revolves around politics. There's been criticism that a lot of decisions being made for public health are politically motivated, maybe to keep the governor's office happy as far as whether or not to bring back a mask mandate or something like that. Can you respond to that criticism? Secondly, any response to the school district's vote last night to make masks back? Some are calling it a mandate, but parents will have an opt-out. Those are my questions.
Sure. I don't see politics at play from my perspective in my city at all. When we had a mask mandate last summer that I imposed through executive order, we were experiencing a summer surge. We were new at this. We'd never been through this, obviously. We didn't have a vaccine, and it was a tool that could potentially slow the spread. But we have a vaccine now. And if private businesses and others want to impose masking, that's their prerogative. And I would ask people to honor that if they choose to do that. I don't have plans to put another mandate in Jacksonville. I did see the schools, their vote last night, and they have given parents the option to opt out. So they're giving families a choice. And I'd like to ask Dr. Soleimani, if you wouldn't mind kind of commenting with your expertise on masking and your opinion there.
Thank you, Mayor. Masking can be efficacious if proper masks are used. And I think what happens is many times masks are used literally as window dressing that just makes us feel better without being effective. I mean, the clear data we have are on N95 masks. Having worked in TB units and ICUs at University of Florida when I was an attending there, they're meant to be used for very short-term purposes because they provide such a great seal that it is just quite difficult to breathe out from. So we know those N95 masks help reduce transmission, roughly into the 90th percentile, which is considered very effective. But again, even those are meant to be worn, sterile, put on, used for a few minutes or to an hour at most, and disposed and reused again. There is not a lot of great data out there for your typical cloth mask, specifically when we've all have observed people wearing bandanas or cloth or homemade stuff. And, there's just information out there that it may reduce it by 30%, 40%. So there may be some reduction, but to come out and say that whether they're really effective, especially when people wear the same mask over and over again, days after days, they throw it on their counters, on their car seats. If anyone actually really thinks that using a mask in that fashion is saving anything or protecting you from anything, then unfortunately they're mistaken. It's just like gloves. During the pandemic last year, we would see patients that wear a glove and are walking around their grocery store all day long, touching different things, thinking that they're protected just because they wore a glove. And obviously that does not work that way. A sterile glove is meant to be worn, used for a very specific task, disposed of, and fresh pair of gloves to go on, not to be used as a second skin all day long. So masks in school, again, it's one of those things that's a personal decision by parents and families, and I'm glad the school board has allowed parents to opt out. But having very young kids myself, I mean, we have a hard time mandating adults to wear masks. I just don't see how a 5-year-old, when I go to kindergarten or VPK, everybody's climbing on top of each other, whether wearing some cloth mask is going to save anything long term. I think as far as kids go, we know they have a significantly better immune system than adults, and which is why we do not hear any significant morbidity or mortality when it comes to kids, unless they have some very specified underlying health conditions. At Avicenna, we have seen thousands of kids over the last year and a half that test positive for COVID, and most of them are very minimally symptomatic, and they all recover quite well. What happens is when they pass it on to their grandparents, to the elderly, and other patients that potentially can be at risk where things kind of get out of hands. So masks can be helpful if proper masks are used and they are used in the way that they're originally intended by the manufacturer.
Thank you, Doctor. David with the Times Union.
Mayor, my question is about vaccinations. First of all, do you know, or do you have any way of knowing what % of the city of Jacksonville's government workforce is vaccinated at this time? And in relation to that, there are some cities and counties, as well as local hospital systems, some businesses that are mandating vaccinations for their workers. Just specifically for the city of Jacksonville's workforce, you have about 8,000 employees, whether that's something you have or would consider as a way to boost the amount of vaccinations that are here in the city through the city of Jacksonville's workforce.
Sure, David, thank you. I don't know the percentage off the top of my head of employees that have been vaccinated. I am not considering mandating a vaccine. I am, however, strongly encouraging people, and we saw it from the event we did over a week ago, to go get the vaccine. You hear these tragic stories of people that end up in the hospital that aren't vaccinated, and they're asking doctors and nurses, can I get the vaccine now? I made a mistake and it's too late. So I would just say to people, don't let that be you. And one of the mayors said, let's do this with love and care. Let's tell those that we care about, that we know, that aren't vaccinated. Let's come to them and let them know how much we care about them. With them, the stories we're seeing and hearing from medical professionals, and encourage them to get the vaccine. Kristen, Action News.
Oh, I'm sorry, I was speaking. I want to ask what your message is to parents that have children that are under 12 that are not vaccinated going back to school now. What should those parents be feeling, as well as what are you doing to ask people to curb this number of cases that we are seeing, besides just asking them to vaccinate? You're still leaving that choice up. What is being done to curb those high numbers we are seeing?
Well, a couple of things. You can get COVID if you're vaccinated. And that's just the reality we're living in, but you don't end up in the hospital. So you're highly unlikely to end up in the hospital, really highly unlikely to end up in the hospital. So we are in a pandemic right now of the unvaccinated. So I'm not considering shutdowns of any form. People need to be able to go to work. They need to be able to go to school. They need to be able to live their lives. And in my opinion, they ought to be vaccinated. And Doctor, I would ask if you had any words of comfort you could offer to those that are under 12 that are in schools that are consistent with the data and the experiences you've had.
The biggest concern we have are kids under the age of 12 years old that have conditions that predispose them and make them riskier to any of the that potentially have long-term asthma or respiratory issues, any kind of an immunocompromised situation, or on medications that would make them immunocompromised. Those parents need to make a personal decision and decide, that's why this mandate is there, to wear a mask, not wear a mask. I also recommend to a lot of kids to use face shield because they're more comfortable than a mask, and sometimes even for people that are immunocompromised to use, they simply just cannot tolerate an N95 mask. The ones that can, hallelujah, use an N95 mask and a face shield, because the bombardment of the viruses that we breathe through our oropharynx area will be reduced if you have plexi type face shield and mask. It's just a matter of how many layers of protection would you like to add to reduce your chances. Nothing is 100%. It's a matter of hedging your bet. And so for parents that have kids that are immunocompromised or diabetic or overweight, we know that obesity is a major risk factor to having with COVID, all of its variants. And those are the steps that parents individually need to decide and make to keep their kids safer.
Thank you, Doctor. Jim, news for Jax.
There we go. Thank you, Mayor. I appreciate this. I was listening today when you were at the roundtable with the governor, and the governor asked you, what does Northeast Florida, what does Jacksonville need? And you had said vaccinations, the people to get vaccinated. Yet there are so many things that we've heard from your administration that we actually do need. We need testing sites. We need staff for those testing sites. My understanding is from the federal government that there's been a request made and it's available to get medical help here to do some of that, but those requests have not been made. It seems that nothing has changed since this surge started in Jacksonville, and we are a hotspot right now. Why not?
A couple of things. We are working with Agape to expand testing to a couple of more sites, actively working together right now. In the health department, we're working with them to add another testing site. And my emergency operations center is in regular communication with hospital administrators and working with them actively on their needs, as am I in conversations. My message right now today, Jim, is we need to get people vaccinated. There is testing available and we are working on expansion. Raymond, WJCT.
Hi, can you hear me?
I can.
So around midnight, you asked about data for if masking had lowered the incidence rates of COVID in counties and cities. I was wondering if you read the replies to those tweets, because some people pointed to a meta study by the CDC released last month that actually did show a reduction in counties and cities that implemented a mask mandate. And one of those studies included in that meta study was also a statewide analysis of Florida schools that showed lower incidence rates of COVID in schools with mandatory mask use policies. I was wondering what your thoughts were on that and if you had looked at that meta study from the CDC.
Well, we have a school here in Jacksonville, a charter school that they were on a press conference with the governor, I think a couple of weeks ago. They didn't mask at all last year, and they had a perfectly safe school year. And I even think the doctor, when he spoke earlier about there's very little data on how effective this is, unless it's a properly fitted mask used the proper way, which is an N95, which are not meant to be worn for long periods of time. So my message today is this. I'm encouraging people to get vaccinated. And the facts are, we did have cities with mask mandates, including ours last year, that saw the spread of the virus while those mandates were in place, even in other states and cities. So I'm not discouraging wearing masks. If people want to wear a mask, if businesses want to require it, they should do that, and people should honor and respect that. If people get vaccinated, we won't be in this situation. Dawn with First Coast News.
Good afternoon, Mayor. 2 questions. We heard you say earlier this morning that your family is vaccinated. So what went into making that decision? And secondly, how are your kids being vaccinated factor into your decision into whether they will wear masks at school?
Sure. Well, I tell you, that's when the vaccine first came out. My wife and I got it immediately, early, as soon as we were in line to get it. We had to have very long family discussions about our kids. Vaccines are new. Kids are at very low risk. It wasn't an easy decision, but we talked to our physicians. pediatricians, and we all sat down as a family and agreed that all of us should have it. In terms of masking, we'll be having those discussions before my kids go back to school here in the next couple of weeks. We haven't sat around the table at this point and had those discussions. One more question, Don with Ola News.
Hello, this is Don with Ola News. My question is, it's maybe for the doctor, maybe for the mayor. I read HSS data and news data that the flu season decreased and flu numbers decreased significantly this past season compared to previous years. Can it be attributed to the COVID safety measures like mask wearing? And if so, why hasn't that information been used to show the effectiveness of those measures and the medical public announcements?
A doctor.
If I can answer this question, Mayor.
Doctor?
That's a great question. And the reason the flu data looks to be low last year is simply because medical professionals weren't testing for the influenza virus. And that's just the simple fact. If you're not looking for something, you're not going to find it. Even, our offices were seeing 150 patients today, very symptomatic, and these patients had a very high rate of COVID-19. The idea was, do these people have COVID or not? Flu had obviously significant mortality, and so across the board, across all physician colleagues that we were talking to, the focus was so much on coronavirus that influenza wasn't even tested. So obviously, if you're not testing for influenza, you're going to find those positive rates. So that's just a fallacy in data because nobody was testing for influenza. You have to realize how many influenza tests actually performed last year versus the amount of positives, and you'll see that the number of tests that were performed across every nationwide were 90% lower than prior years.
Thank you, doctor. We had an issue with the audio there, so we'll get that what the doctor just shared. We will get that to you, and thank you for the question. Thank you for your time today. Thanks.